This is what concerns me when I look at this number 344 million plus teleconsultations in India, because there are situations where frontline specialists report that only 20% of referrals are actually appropriate for their specialty. Volumetrics can mask the massive amount of quality gaps. And that's the measurement challenge takes us directly to your framework, Dr. Joshi, because you didn't just identify the problem of inconsistent success metrics, you actually built a solution. So, coming up next, the telehealth success framework, the 5 pillars, how organizations implement it, and what it reveals about the sustainable virtual care program. So, now let's move to what every healthcare leader really wants to know. How do we really measure whether telehealth is working? Because scaling without reliable metrics isn't just a progress, it's expensive guesswork. That's where your telehealth success framework, in my mind, comes in. And so, walk us through those 5 pillars, and what gaps in traditional measurement made this framework so necessary.
Right. Yeah. Thank you for bringing that up. So, this framework I actually co created with my co author of the book that we outlined, the Telehealth Success Framework. But basically, when we were talking about it, we are thinking, okay, what have we done in the past that allowed for these programs to be successful? Now, just in my, of course, history, I've built 13 programs, and not all of them were successful in the beginning or were successful overall. And so, there's lessons in all of that, but more important. So the first is patient success. And, to your question about how do you make sure that it's working? I mean, the biggest thing you have to know is your patient population, who you're serving, and what you're doing. We can talk about that, even if we're going to compare India and the US, there are things that are very different about India and the US, and there are things that are actually very similar, right? There are
Yeah,
access gaps, connectivity,
yeah,
you have that issue. But of course, the languages are going to be much, much different in India than in the US.
yeah,
So you can compare it that way. But really, so the
yeah,
question, how do you make sure to do that?
right.
Second is the clinician success. And this I always find probably most dear to my heart, mainly because when I think about, and most dear to my heart, I mean just because I had to do it personally, being a doctor myself, and
Mm,
having to convince my colleagues of why this was safe. How do you
mm,
develop quality care, like you were bringing up? And how do we make sure that the ways and the methods and the regulations that we have in place for in-person care actually
mm,
translates into clinicians?
mm,
And so a lot of the easy question to your question about the quality is training. And I'll say that's partially true, but it has a full, larger answer to that than just that. And it really dives deep into how do you scale the clinician workforce to use digital tools of the future. But that's a subject probably for another podcast itself. But the one thing I want to add about that is it's really also about leadership and who is a right leader to do this and what kinds of leaders have to be in place to actually be able to build and do this for you. The third is technology. You have to pick it, you have to have the right one. And we both, I'll say that in general, it has to be the most simple one. It is I have been pitched many, many types of products in the last few years. And of course, I'll say that the ones that work the most are the ones that people can use easily and have the bare minimum for what people are trying to build. Fourth is reimbursement. We just talked about that. How do you reimburse it? Because without that, it's almost impossible to scale anything. And so, like you said, you're going to just have expensive guesswork because you're not going to be able to build it out. And you're not
yep,
going to be able to show if the economy is building, is a health care system actually helping patients overall, if you can't actually look and see if it's paid for. And then last is compliance, which is a bit of a catch all term, but what it really means is what are the laws and regulations? How do you avoid fraud? What is malpractice? That's a big deal in the US. I know it is in other countries as well, but really, how do you make sure that you are legally protected on all fronts? All the things that you need to do to make sure that the program itself is compliant with the regulations. And so
right,
that's the way we built it out and thought about
right,
it for
correct,
all programs
right.
that need implemented.